my name is Dr. Shairi Turner, and I'm the Chief Health Officer at Crisis Text Line.
So what inspired you to get into the medical field?
So to get into the medical field, since I was a teenager, I had wanted to become a doctor. My brother suffered from asthma, and I really saw the contributions that physicians can make to helping people, to helping children. I was a biology major at Stanford University, kind of typical pre-med, type A, really hardworking. And I was the first person who was ultimately going to be a doctor in my family. And when I started med school, I definitely intended on becoming a primary care physician, helping communities and people in underserved communities, adults and children, to really navigate their own health care. I went to Case Western University School of Medicine, and then I was accepted into the Harvard Combined Internal Medicine and Pediatrics residency program, really intending again to treat adults and children in primary care settings. And then during my medical residency, a very close friend of mine, family friend, died of suicide, and he was incarcerated at the time. And I had visited him in prison multiple times. And looking back now, you could see that the whole family, there was a whole kind of cycle of generational trauma that existed in his family. But I still, went ahead and finished residency and decided after residency that I wasn't sure the direction that medicine was heading at the time would really allow me the opportunity to spend time with my patients, because there were so many issues like the insurance regulations around productivity and seeing one patient every 15 minutes. And to me, it was really about talking to my patients and building a relationship. And I felt like I couldn't necessarily do that, but I wasn't sure exactly what I wanted to do. So I became interested in public health. And I wasn't sure how that would fit into my career goals, but I applied for and was accepted to the Commonwealth Fund, Harvard University Fellowship in Minority Health Policy. And that was really an opportunity for the fellows who were either minority physicians or dentists to see public health at a higher level, to see what physicians could do to impact communities of color in leadership positions with a focus on public health, so community health. During that time, I did a practicum with the Department of Youth Services and in Massachusetts, and studied some of the substance abuse policies for their minority adolescents who were incarcerated. And ultimately, my first real position was as the chief medical director for the Florida Department of Juvenile Justice. And that was kind of my entree into public health and looking at trauma and mental health.
How did you get involved with the Crisis Text Line?
Right. Life is a journey, Michael. Right?
Yes.
Clearly not a straight trajectory. So I actually, through networking, the founder and CEO of Crisis Text Line reached out to me back in 2017, and I joined Crisis Text Line as the first chief medical officer at the time. And I was responsible for our crisis supervision team. And those are the mental health professionals who supervise our volunteers on the platform. Then I left and then returned in June of 2020 as our chief transformation officer, guiding our organization's culture transformation, focused on embedding equity throughout the organization. And then I transitioned to my current position as the chief health officer, where I lead the public policy and advocacy team and handle the organization. We handle the organization's external policy and advocacies and government and university and education partnerships as they pertain to mental health.
So can you tell me a little bit about the Crisis Text Line?
Yes. So Crisis Text Line is a national not-for-profit organization that provides free 24/7 text-based mental health support and crisis intervention in English and in Spanish. And anyone can text help to 741-741 or ayuda to 741-741 to be received by a live trained volunteer who is supervised by our staff mental health professional, the crisis supervisors. And we like to consider ourselves a mental health emergency room because we have a texting triage system that allows us to identify through words that texters use whether they are at higher risk for suicide, in which case their text is pushed to the top of the queue and they get an opportunity to be connected to a volunteer sooner.
So when talking to someone going through a tough time, how important is empathy?
Empathy is paramount. Empathy is hugely important because empathy is really the capacity to feel what another person is experiencing, to step into their shoes or their frame of reference and really be able to see life through their position. And it's important to be empathetic and understanding when someone is going through a crisis. And we always say a crisis to you is a crisis to us because it's not about our volunteers or our service judging in any way what someone finds to be a crisis, what someone finds to be incapacitating. So our volunteers are trained to be able to support anyone from someone struggling with their homework to someone who's on the verge of suicide. And it's because our 30-hour online training prepares them to be empathetic no matter what the crisis might be.
Have you seen the stigma of just talking about suicide prevention lessening?
So yes, I think it's amazing. I believe that the pandemic was a real accelerant for people to start discussing because they just couldn't, the isolation kind of put everybody over the edge.
Yeah.
And people felt like they didn't know where to turn. And then we started to see athletes and celebrities talking about their mental health and pausing their careers. And these are, people who, generally celebrities, people think that, everything goes well in their world,
right.
But they're there saying like, I have to stop. I can't be an elite athlete and continue to deny my mental health or to deny that part of my well-being. So, that in and of itself started to give words for people to start to talk about. They could talk about the context of an athlete who was sharing their mental health journey, but in doing so, it gave words and it gave the ability for people to start talking about it themselves. And then, we start to see more resources. We have, in the midst of the pandemic, telemental health. So people are able to get, some folks are able to have access to more resources. But I do feel like it's still a process. There's so many people who do not have the mental health services, at the right time at the right level with the right kind of mental health provider, and they are in need. But at least we're now trying to shine a light on the stigma and elevating it and having the conversations so people will start to get some support.
I know for me, for telehealth therapy, that changed my life. Just being able to access it's much easier than before.
Yes. And when people in crisis reach out to us at Crisis Text Line, they can reach us at any moment, 24/7. And to have that confidentiality and anonymity, and be anywhere from, your bedroom to the boardroom, because anywhere everyone is, people are texting us. People are texting in general all the time. So no one has to know that you're in crisis and you're reaching out for help. So I think accessibility has changed the game for so many people.
How does it feel for you to be helping people?
So it's a personal journey, right? It's filled with all the things, all the emotions, the challenges, the reward of helping other people, but it's also even more so humbling. And it's humbling because, both personally and professionally, to be in this organization helping others, to be in a space where you can give support to someone else, where you can empathize with someone else, is a privilege, right? Because it means that you have a certain level of personal stability and personal well-being that allows you to say to someone else, come, let me sit with you. I can take some of this load from you and help you out.
What are some of the things that motivate you?
So helping people has always motivated me. I think going into medicine for that reason initially, because I could help people. I wanted to help people navigate their own health and empower them around their own health. But empowering people now to take control of their self-help and their self-care and well-being, showing people how their childhood experiences or their adverse childhood experiences tie to their current mental health and well-being really motivates me, because I think as people start to understand that, what happened to them as a child and what continues to happen to folks, just in and around our current, the current world environment, has a direct impact on what they experience and how they feel today. And then equally, I'm motivated by sharing my own experiences about mental health and helping people understand that there is light, there is a pathway out of the darkness, and that therapy is effective and treatment is effective. And just acknowledging that there's so many new ways to try to seek support now that didn't used to exist, and how much that can help our day-to-day well-being. So I'm motivated by all the things that help us to normalize good mental health and well-being for everyone.
Well, you do a lot to help others, but what do you do to help your own mental health?
So I believe in the power of therapy. I believe that sitting and talking to someone and talking through your concerns, your worries, your stressors is helpful. I believe that. I also believe in the power of sleep. So I think everybody, personally, I make sure that I get 7 to 8 hours of sleep, because I know it correlates directly to my mood, to my well-being. I try to exercise regularly. I try to drink a lot of water. All the things that we try to do to support our body actually very much impacts and supports our mental health. I also am very clear about, who I spend my time with, right? Like, am I with people who are supporting and uplifting, positive, or am I spending my time with people who are negative and struggling, right? So it's one thing to be around people who you're trying to help uplift, but it's another thing when people are trying to detract from, your own light. So I'm very clear about when and where and who I spend my time with. And then I really think that it's important that I find the world news and the world news doesn't find me. And what I mean by that is I curate kind of what comes into my mind, because there's so much going on in this world that is devastating for people. I mean, we know, we don't even have to list it out, both nationally and internationally, but there's only so much of that I have control over. And when I allow all of that imagery to just, turn on the news and there it is, that's different than what I like to practice, which is when I seek out, updating myself on the world news and what's going on nationally and internationally. I do it in a very prescriptive way, meaning I will find it either through print or through audio and not necessarily through visuals, because I feel like that has so much more of an impact on what goes into my mind and stays there, right? And I choose I choose what I can do. So how I help people in my work and personally and through relationships and friendships is my contribution to goodness in this world, right? I know that there's only so much that I can control. And I think lastly, for my own mental health, I really am practice gratitudes and just give thanks for my family and my friends and the opportunity to serve people in the way that we do at Crisis Text Line.
So where do you want to see the organization, say, in the next 3 to 5 years?
Yeah, so in the next 3 to 5 years, Crisis Text Line is going to be about impact. So global impact, expanding access, and being or continuing to be this in the moment resource for people across our country. There is continuous need for this. The pain isn't going away. The stress isn't going away. And we really want to be about that global impact. So connecting people to resources, to services, so that they too can feel the benefits of mental health and mental health support.
How can people reach out and learn more?
Yes, anyone can text help or ayuda to 741-741. They can reach us on WhatsApp and web chat on crisistextline.org. We are available 24/7 for anyone who is in need, in English or in Spanish. If anyone wants to make a difference, that they can please find us on crisistextline.org. And how to become a volunteer is one of the links there. And they can take our self-paced 30-hour training and become a volunteer to support others in need.
Voice is Virginians Organized for Interfaith Community Engagement, VOICE. And they started in 2008 right here in Northern Virginia, organizing interfaith, Muslims, Christians, Jewish communities, other even non-religious community groups partnering together to really organize and bring power and money to bring real change to our communities. We have worked really hard on bringing affordable housing to Northern Virginia. Right now, we're in a huge campaign around bringing better mental health care to the whole state of Virginia. We've worked with criminal justice reform. Just in 2019, we were able to get a public defender's office here in Prince William County. We were one of the last large counties in the state of Virginia to get a public defender's office, and we were really great to be able to bring that here to our community.
And with mental health, Prince William County is working on a future crisis receiving center. Can you tell me a little bit about Voice's work on that?
Yeah, so during the pandemic, one of the things that Voice does to help us understand the issues is we hold listening sessions. And we listen to community members to find out what issues are bubbling up. And we held, I think it was before the pandemic, we held some listening sessions with returning citizens, people who were coming out of our criminal justice system and back into community. And one of the things that we were hearing after chatting with, I think, over 300 individuals was just how much mental health was part of our criminal justice system, and how many people who are experiencing struggles with mental health were actually caught up in our criminal justice system. And so we were hearing that we needed to find better mental health care. So over the pandemic, now we were finding ourselves having conversations with learning about the new Crisis Now model for mental health and learning about crisis receiving centers. One of the first times we heard about it was they're operating out of Arizona. And so we got to meet with the folks in Arizona who are doing it, who have the model in place, to learn how we might be able to bring it here to Virginia.
Yeah, I've talked to them, Connections Health actually,
Yes, that's
before, and they say working with Prince William County has been great, and seeing they're creating something completely different that people haven't seen before.
Mm-hmm. Yeah, so we've worked with them, and then even working with other experts of that same field, the Recovery International. We've been able to talk with them too. They were the ones who had been operating the Crisis Receiving Center out of Chantilly. And we voice leaders even took a field trip down to Durham, North Carolina last year to see an operating crisis receiving center that didn't have some of the regulatory bump ups that we've been experiencing here in Virginia, just because Virginia doesn't have a crisis receiving center model to even know what regulations it needs or doesn't need. So that was just really neat to be able to see one in person and to see how it can operate here.
So how's civilian life treating you?
It's fine.
When I got out, I didn't want to admit that there was anything wrong because I felt like a failure. Maybe you are fine, but if you're not, it's okay.
Thank you.
Veterans, find resources at va.gov/reach.
I wonder if you know that I want the best for you. That I know what you're going through. I know things aren't easy, but you still show up. I wonder if you know that we can get help. That we don't have to go through this alone. Let's see how far we can go. Love, your mind.